I think that there are at least a couple of barriers that I could identify. One would be simply a lack of knowledge of the guidelines. I think we've used every opportunity to try to disseminate the guidelines in a variety of different settings. One can look at our MASCC website and have the full content of our guidelines available in either a downloadable PowerPoint presentation or a PDF file. We've tried to present them in numerous different forums, professional meetings, etc. But clearly there's still a significant number of providers that probably are not aware of the guidelines, and I think that's one of the barriers. I think one of the other barriers is that there's a sense on the part of many physicians and to some extent nurses that perhaps their patients don't have these problems. And I think that to a great extent there's a number of studies that have showed that if you don't ask the patients about these issues in terms of nausea and vomiting at intervals after their treatment, you may never find out whether they have it or not. And so those studies have shown when they've actually asked patients at fixed intervals subsequent to their treatment whether they had these symptoms, I think they were surprised at the frequency with which those symptoms occurred. And I think the providers were very surprised to see the results of those surveys. So I think part of it is getting a better dissemination of our guidelines, and secondly, getting the individual providers to understand that there still are problems that exist with the therapy that's being utilized, and they need to recognize that and then try to increase, the intensity of some of their antiemetic approaches.